If you're sitting there thinking there is no way I'm getting induced, I've got news for you. Today, I'm going to share the top 3 reasons why people get induced and what you need to know about each of those reasons moving forward. And why on earth would I know so much about induction? Hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. And not only have I induced thousands of patients, but I've actually been induced on my own. So I'm excited that you guys are here, and I think I've got so much good information for you moving forward. Okay, let's talk about the 3 most common reasons why people get induced. I want to be really clear that this list is not exhaustive. I actually have a list on my website of the most common reasons why people get induced. And if you want more information, you can check that article out. I'll put the link down below. And these aren't like in order of how common they are, but the first one I want to talk about is preeclampsia. And this is something that catches a lot of people off guard. By the way, if you're early in your pregnancy, aspirin has been shown to decrease your chances of getting preeclampsia. So definitely talk with your provider about aspirin in pregnancy. Now, most often we find preeclampsia because you have high blood pressure in your doctor's office. You know that they take your blood pressure at every visit. I know for a lot of you that initial blood pressure is high. I know it always was for me. It was probably from hauling my kid and all their crap back into the office. And maybe the sound of the blood pressure cuff isn't my favorite after being a labor nurse for 20 years. But mine was always high, the first one initially, and then I'd ask them to take it as I got more relaxed in the office and usually it would go down. But if you have high blood pressure, we need to take it seriously. And preeclampsia is one of the reasons that a lot of people get induced. Now, another thing that people sometimes have is a headache that just will not go away, especially if it's a pounding headache or if a patient comes in and says, this is the worst headache I've ever had in my whole life. I really take that seriously, and preeclampsia labs are something that we would order. Yes, preeclampsia is diagnosed through lab work, usually protein in your urine, platelets, liver enzymes, uric acid. Those are usually the things that we're looking at, and we're seeing how the effects of the placenta are impacting your body. Now, preeclampsia is more than I want to get into in this video. If you guys want more videos on preeclampsia, tell me down in the comments. But preeclampsia is definitely a reason that people get induced, and it's often the one that catches people off guard because you've lived your life young and healthy for a long time, and now all of a sudden you have lab work that's off, and it's just surprising. And while you're down there in the comments, tell me if you are planning on induction or not planning on an induction. It'd be fun to have kind of a poll down there. Okay, the second reason that people most often get induced, and this is a conglomerate of reasons, is a problem on the ultrasound. Now, there are lots of problems on the ultrasound, but the top ones that I see are baby being too big, baby being too small, too much amniotic fluid, too little amniotic fluid, or sometimes there's other issues like the insertion of the umbilical cord in your placenta or other things like that, how baby's growing, doppler flow studies. There's a lot of reasons why you might get induced from an ultrasound. And again, your doctor is the expert in the room that knows when to order these ultrasounds and what the results mean. You're just here to understand that an ultrasound might be a reason why you need to get induced. Now, there is a lot of gray area in this whole thing. The whole too big, too little baby thing, lots of gray area. You'll see people commenting that their baby was supposed to be 9 pounds and there were only 7 pounds. So you need to know how to talk with your provider, balancing both your preferences for your birth and what the lab work and what your doctor is seeing, and balancing both of those things. I actually have a birth plan where you can learn kind of what you want to value for your birth. I'll put the link down below, and it's super helpful to get you guys started on making choices in advance for your birth. And again, balancing those choices with what's going on right now. Now, the final reason why a lot of people get induced is elective. That means you are making the choice to be induced. Now, usually this only happens after 39 weeks. There's a whole study about it called the ARRIVE trial that people just love to argue about online. And I actually do a deep dive of that whole study in the online prenatal class for couples if you're looking for more information on that. But elective, choosing to be induced, is a reason that a lot of people get induced. Now, this can be for a variety of reasons. Number one, convenience. I gotta say, on my third, I ended up getting induced. I had gone into labor naturally on the first 2, but there is something magical when you have 2 other kids to figure out daycare for, to knowing that you're going in at Monday at 8 a.m. So convenience can really be a reason why people need it. Maybe your mom's in town, maybe your doctor's in town and you really want them to be induced. All of that is fine and valid. Now, maybe you're in a lot of pain. I have a ton of videos here on YouTube about different kinds of pain in pregnancy, but a lot of people at 39 weeks are ready to be done, and they just want to make the choice to be induced to be done. And finally, in conjunction with too much pain is too many false starts. Sometimes people think they're going into labor every night from like 38 weeks on, and it's just not going anywhere. And they ultimately just want labor to jump over that bump and finally go into labor. I have a whole video on false starts. I'll link it down below as well. And I'm here to say that all of these reasons are valid, and I'm glad that we have the opportunity to choose to be induced at 39 weeks of pregnancy. And make sure that when you're learning about pregnancy, you're learning from someone who is unbiased and ready to take what you need and make it work for you in the hospital. Now, we've talked about the reasons for induction, but there is something that nobody talks about. I guess people think it's too complicated, although it totally is not. But this is the reason why so many birth plans get thrown out the window. I'm going to link a video here. You guys totally need to watch it. If it is not up yet, because it is coming, hit the notification bell so you can be alerted for when new videos come up. I hope you guys found this video helpful. 3 reasons why people are commonly induced: preeclampsia, problems on the ultrasound, and making the choice to be induced. I hope I'll see you around next time.